You remember what it was like. And to be honest, Dr. Wood, I know what you're talking about, but at the same time, I don't know if it's really as relevant to most of what we do. If someone has diabetic retinopathy, they need to change their diabetes control and get laser therapy. If they have glaucoma, they need to use regular drops and administer them properly. And if they have a corneal ulcer, I'm going to make them use Tobrex every hour. I understand the value in somewhere like oncology or geriatrics, but there's a reason we didn't choose those specialties, right?
Actually, Lauren, I completely disagree with you. I think that what we do is very holistic medicine with significant impact for our patients, and they deserve our respect and our time. Now, do you disagree with that?
No, but that's not what I meant.
Really? Because it also seems like you're being quite disrespectful of your patients and of their ability to make their own decisions.
Well, sometimes they can't. And my job is to limit poor outcomes.
Is that how you see your patients? As outcomes? Laura, I'm sorry, but your perspective is really quite concerning, and I'm simply not comfortable with signing off on this rotation with your kind of attitude. I've seen this happen once too often.
What? What do you mean by that? You can't fail me. I've never failed anything in my life. It's not like I don't know how to communicate. This has got to be a joke.
I do not appreciate you talking about communication as a joke, Lauren. This is a key attribute that we expect of all trainees. Now, if I look through this form, there are a number of areas where I feel that you're unsatisfactory. Now, communication is definitely one, but I would argue that your roles in relation to being a collaborator, a professional, a manager, a health advocate are all significantly affected by your lack of care and communication. Now, until you're capable, you'll need to work on this skill. Now, I'll be letting Dr. James know about this. He's your next supervisor, isn't he?
Well, yes, but what are you going to tell him? This isn't normal practice, is it? You can't...
Perhaps that is part of the problem. Have you had this feedback before, prior to this rotation? Well, look, I'll be letting Dr. James know about your lack of insight into the value and the skills of patient-centred communication, and providing him with a copy of this report. I shall be expecting you to re-attend the communications workshop, and I'll be talking to the Director of Training about other training options that you'll need to complete before you can pass your exams.
Can you do that? You can't stop me doing my exams. I'm fine at communicating. Yes, there's stuff I need to work on, but it's not related to my clinical ability.
That's where I think you and the college disagree, and that's what concerns me. So, Lauren, I would like you to join me in my clinic this afternoon so we can sit and talk about the communication issues that arise and how they're dealt with.
But I'm meant to be assisting in theatre with Dr.
Chris can do that. So, you'll be in clinic this afternoon. Do you understand all the things we've talked about so far today?
Yes. Yes, I do.
Good. Thank you.
How would you characterise the strategy the consultant adopted here? Do you think it worked? How did the consultant address the trainees' problems in this interaction? And who mostly controlled this interaction?